Hi, I'm Kevin Wade. I'm a therapist at the St. John Clark Pain Treatment Center in Clearwater, Florida, and I practice neurosomatic therapy. I wanted to answer a question for you today, actually two questions. The first being, when we start with treatment in our clinic, many people ask, how many treatments is it going to take? How much time is it going to take for me to start feeling better? Completely valid question. Not only from the standpoint of I feel bad and I want to feel better and I want to know how long this is going to take, but as far as people trying to budget their time and their money and all of that, we'd like to try to come up with an answer for that. It's a little difficult sometimes. There are lots of variables, someone's age, someone's state of health, how long they've had their pain, how severe, how complicated. These are all factors. But in general, what we see with the large portion of our patients is that their pain is significantly diminished or eliminated in about 8 to 10 sessions. So we're talking about, a couple of months worth of work to deal with, a chronic pain that may have been around for 10 years or more. Well, we see the whole gamut. So the issue there is, sometimes it takes less time. Sometimes it takes a little bit more time. Most of our patients report that within 2 or 3 or 4 treatments, they're noticing some substantial changes. So this is all in terms of what to expect when you come in for treatment. The bigger issue that I wanted to talk to you about today was that, once we've gone through that process of eliminating that chronic pain or that acute situation, that severe pain that's been bothering somebody for a while, the question always comes up. This is question number 2. What do I have to do now? How should I approach my health going forward? I feel good. I want to keep this. What do I do? And in some cases, through treatment, we're able to talk about stretching that they can do or guide them towards some exercise programs that they can do on their own, homework that they can do to keep things in good shape. But there's also the issue of doing neurosomatic therapy going out into the future as a maintenance effort for people. We tend to get excited and really focused on the problem solving and to, really helping people who have been in some really severe pain for long periods of time. But there's the other side of it. There is the idea of looking at neurosomatic therapy as a part of your wellness plan. It's the way I like to talk about this is that once you get somebody in balance, the more they stay in balance, the more that they're moving well and they're staying out of pain, the more likely they are to stay out of pain. Right? This is kind of an axiom throughout healthcare. The healthier you are, the more healthy you are likely to be, or the more likely you are to stay healthy. Right? So, in terms of kind of the movement in healthcare to look at our system, our efforts that we make, kind of focusing on preventative and wellness care, neurosomatic therapy fits right into that. As far as the capabilities that healthcare has already in trying to remedy situations where people have a problem, they're ill, they're injured, they need some intervention to help them, neurosomatic therapy does that as well. So how do we think about neurosomatic therapy in a well-care maintenance kind of way? Some people get through their treatment and get out of pain and they're feeling great and they make a decision. This has helped me. I want to keep doing this. I'm going to put myself on a regular schedule of maintenance, and what that is for each individual can be different. Once a month, once a quarter, every other month. It's very different for different people. But usually patients kind of settle into a routine where they find that if I go for treatment every couple of months, check in with my posture, make sure everything is online, is going well. I stay healthy, I feel good, and I can engage in all of my activities, sports or working out or family or recreation, whatever it might be, their work. So people sometimes settle in and they find that regular interval and they come once a month or whatever that might be, and that they just make that part of their healthcare plan. That's their plan to keep their structural health in line. right? This idea of structural health, our alignment, how our soft tissues are working, how we're moving, all of these kinds of things. On the other hand, there's patients who find that going through the process of neurosomatic therapy and becoming aware of how their body works gives them this ongoing awareness of their bodies. It's actually quite common when people practice body work techniques or exercise techniques that are particularly kind of internal and focused on movement and posture, yoga or Pilates or Tai Chi, things like that. People start to gain an awareness of their body and how they move. And for those folks, their maintenance plan kind of goes like this. I'm going to pay attention to how I'm feeling. When I feel like something is getting a little bit off, or I'm not feeling quite right, I'm going to go in and get some treatment. Schedule a couple of treatments, 2 or 3 treatments, get a little bit of work done, get everything back in line, and avert the crisis, right? That's where I really, I feel so bad when I hear this from a patient. They come in, they're in pain, they got some really severe pain happening, a strain in the back, a crick in the neck, whatever it might be, and they say, wow, I really felt like things were going a little bit south 3-4 weeks ago. I knew I should have come in. I got busy, I wasn't thinking about it, I was trying to ignore it, and now look at me, I'm in a lot of pain. It happens that way often that I hear from a patient, oh, I was feeling it coming on, and they didn't do anything about it. So, it's important to listen to your body. It's important to be in touch with how things are working for you, how you feel, paying attention to your health, to your state of balance, right? The more you are in balance, the more you remain in balance, the more likely you are to continue to be in balance. And that is, what we would like to promote for our patients. So, if you have been through treatment, if you're in treatment right now with us or any other neurosomatic therapist who might be, working on you anywhere around the country, think about that as far as your plan for the future. How can you use this therapy that's been helpful to you going forward? If you're new to this idea of neurosomatic therapy and you're thinking about coming in for some therapy, getting treated for the problems that you're having, think about that too. Kind of look at that as the big picture. Yes, I'm going to go in and I'm going to get better and I'm going to take care of this pain, but then what do I need to do afterwards? So that's the tidbit of information I have for you today. We'll be coming out along with some more videos periodically here with other bits of helpful information. Take a look at our YouTube channel, subscribe to that. You'll get notifications when we've got exciting new information for you. Thanks very much.